Namaskar friends, this is Shekhar Mayanil here and you are watching Yogic Realization channel. And today we'll be talking about the brilliance and the beauty of Bhramari Pranayama, which is a disease prevention yogic neuroscience presentation. So before I start, I would like to bow down to Ganeshji and Hanumanji also to bless me with the right words so that it can reach you, right? So let me start the presentation directly. So hang in there. Okay. So this is the title, The Brilliance and the Beauty of Bhramari Pranayama, a yogic neuroscience perspective. Okay. Nikola Tesla once said that if you want to find the secrets of the universe, think in terms of energy, frequency and vibration. In Bharatiya Sanskriti, we have already figured that out million years ago. I would say that several thousand years ago. So you see this when you enter a temple, a Hindu temple, you always see one big gong outside the temple. Now somebody says, what is that meant for? It is meant to create low vibration frequency in your brain, activated. Then when you go inside the temple, the center part of it has a different frequency bell sitting here. And you go inside the Garbhagriha where the deity is sitting, in this case Hanumanji is sitting here, and the bell is, the pujari rings the bell with his hand. It's a very high frequency, compared to this is dong, this is very high frequency. So what it does is basically takes care of all your chakras. Basically this is the Muladhara chakra and this is your Sahasra chakra. So in between everything is covered. So that is the beauty of those temples. If somebody says, my mother used to always say, just go sit in the temple, everything will be okay. If you have messed up or if you have some worries, or just go to the temple, sit there and just move around and come back. It takes care of itself. So let's talk about the yoga and the pranayama and the neuroscience aspect of Bhramari. I'll first talk about the yoga. What yoga has done, and these studies come from Boston University as well as Harvard University, and what they've seen that yoga increases the brain gamma aminobutyric acid levels, and gamma aminobutyric acid levels are very low in depressed patients and with people have anxiety disorder. So if you do yogasanas, their GABA levels suddenly increases and they feel better. Now in the brain it has been shown that the subventricular zone, I'll talk little bit later what subventricular zone cells are all about. Those are very responsible for neurogenesis in the forebrain post migration of the neural stem cell from the subventricular zone cells. So this is a subventricular zone and this is the stem cell that is migrating, becoming neuroblast, and down the road it will become mature and it will form neuron and they will make connections. So this is the migration movie that you see here. Okay. Now what is subventricular zone cells? So in the brain there are ventricles, right, which they are basically hollow cavities inside the brain, but they are filled up with cerebrospinal fluid. And the cells lining these ventricles, the cells lining this ventricle, they are subventricular zone cells, and they are stem cells in nature, most of them. So these are the ones which go and populate the dead cells. Somewhere here some cells died. So these cells from the subventricular zone cell will go migrate it and populate this area and make neuronal connections. That is what it is. Now what is Bhramari? How am I connecting this whole thing to Bhramari and the subventricular zone and all that? So let me demonstrate what Bhramari is. So let me stop share and I'll share with you how Bhramari Pranayama is done. So what you do is with your middle finger, what you do is you close your eyes and this tip touches your nasal bone here. Here we have and then with this index finger touch your very gently touch your uh, eyebrows, end of the eyebrows, and the ring finger touches the nostril, just below the nostril, but not closing the nostril as such, and this the small finger just below your lower lip, and the thumb you completely close your ears, both the thumbs, and then you do chanting of Om without opening your mouth. So the sound that will come out is that type of sound. So let me first demonstrate the simple one, and then I will talk about little complicated, not complicated, little advanced version of Bhramari by increasing the frequency. So let me do the first. Take a deep breath and watch when you're exhaling after doing the M. The abdomen should go all the way in. That's the beauty of it, right? I'll tell you again. Okay, let's start. Inhale deeply. So what I did was I exhaled it and I saw my abdomen going in like that. So what this abdomen going in does is it activates your vagus nerve network here, and that sends the signal straight to the brain, in addition to the sound vibration that is being created by chanting of right? That's the beauty. Now what you do is after this you can increase, either you do 7 times the same frequency, low frequency, or you can do the sa re ga ma pa da ni. So all that sa re, all the sound intonations will be with different frequencies will come up. So first one you do sa re ga ma pa da ni. This is what you can do. So you can increase the sound intonations with frequency. Intonation means different frequencies. Then what happens in the brain is there are so many brain cells. Somebody will vibrate, right? Because of, so somebody will take up the frequency and vibrate with the same frequency. Like when you bring a tuning fork, one you hit it and the other one is sitting quietly, it doesn't matter. You bring it close to it, that also vibrates with the same frequency. The same thing happens here. And what happens is the subventricular zone cells, the cavity lining the ventricle, these are the ones which produces the stem cells, and they go and populate the brain areas. So let me go back again to discussing what we have been discussing about. So there you are. Okay. So this is what the demonstration was all about, and let me. So the Bhramari Pranayama does what somewhat like the tuning fork experiment described below. So you take this experiment. I think everybody must have done it in 6th or 7th grade or something like that. So they have this beaker filled with water, and you bring a tuning fork which has been hit nicely, some whatever the frequency is, and you bring it close. And what happens is you see the wave, the water waves are coming and hitting the vessel wall. Now if you consider this portion as your ventricle and these as your subventricular zone, what happens is when you are doing the Bhramari chanting, Bhramari Pranayama, the waves go and titillate these subventricular zone cells here, and they start to migrate now. This is exactly what I don't know exactly what is there, but I have visualized that probably this is must be happening. So what happens is, this is your ventricles, right? This is your lateral ventricle, and this is your third ventricle. And when you do the Bhramari, most likely that's what must be happening, that these cells are getting, see, any cells which get the energy of sound energy, let's say, will not stay in the same state as it was before. So something will migrate here. So this is what I will show. So I'll show you a movie. So these cells are the ones which are migrating. You see, so this is a subventricular zone here, and uh, and these cells are migrating, populating the forebrain as well as the motor cortex and other part of the cortex also. So this is extremely fascinating thing that I saw, and of course I think it can be triggered by Bhramari. So what in during Bhramari, it has been seen that there are paroxysmal gamma waves produced in the during Bhramari Pranayama, and these are linked to enhanced cognition. Don't ask me what the whole detail of Bhramari, the proximal gamma waves. It will take another hour to discuss that. Anyway, it enhances cognition. There is an extremely high awareness, focused awareness, and if you sit immediately after Bhramari quietly, let me tell you, you will feel deeply spiritual. Mind will be so quiet and calm. It's just beautiful. So these are the different brain wave that are produced by different human activities. One of them is gamma waves, which is produced in Bhramari and chanting of mantras. Then it is a beta wave, which is done in Thopukarnakam. Thopukarnakam is basically holding your ears with opposite hands and doing the sitting up and down. That's what Thopukarnakam is. It has been shown to be extremely beneficial for people with autism spectrum disorder, and super brain yoga they call it, but it is Thopukarnakam, which is very much practiced in southern part of Bharat. And of course yogasan, we already seen that it produces alpha waves which are 8 to 12 hertz, and theta waves produced by shavasana and yog nidra, lower and lower. So delta waves are produced in deepest dhyan, which means deep meditation and deep awareful meditation, plus also in the deep sleep. So this particular thing helps in regeneration, empathy, compassion and all that. So how does these when you go to the temple and all that, or when you chant Om, what does Om do actually? Om chanting produces a 432 hertz frequency, which actually is between Manipura chakra and Swadhisthana chakra, basically the vibration resonance frequency. So when you do the Om chanting, this is what happens. On the other hand, when you do Bhramari chanting, the part of it, the overall vibration frequency that is produced inside the human skull is between 800 to 1.2 kilohertz, just twice. So Bhramari, Om just produces 432, but when you do the Bhramari, which means in that Om, the M part of the Om is the most energy giver, basically, right? So that is producing directly 800 to 1.2 kilohertz. So when you do the sa 800, that produces 800. If you do the Sa re ga ma pa da ni. If you go to ni, then what happens? That ni is the sound with which you are saying the that will generate 1.2 kilohertz. So that is exactly what is the reason for enhanced cognition, focused awareness, and deep spiritual states. Bhramari Pranayama and the role in healing has been done extensively by Japanese scientists. Of course, experimentally derived. The Japanese science is always like that, right? So what they did was they measured the nitric oxide level after the humming or without the humming, and they found out that it was 15-fold increase. And as also the study from Stockholm, Sweden, Karolinska Institute, they also found that the nitric oxide level is increased 15-fold during the humming, which means Bhramari humming, humming. In India also it was done like that. Similar studies was done during COVID time. They wanted to make sure that uh, is is that is Bhramari can help COVID patients or people who have been affected or having pulmonary hypertension and things like that. So what they observed was it reverses pulmonary hypertension. It increases the survival rates of those patients who are very critical after COVID infection and prevents blood coagulation and morbidities due to COVID-19. In what cells are these produced? You might ask, right? Nitric oxide is basically produced in endothelial cells. Now, this endothelial cells means, let's say this is the blood vessel, right? This whole thing is a blood vessel, and this one is the lumen inside. So the cells lining the lumen are these endothelial cells, right? These are the ones which produces the nitric oxide, and when they produce nitric oxide has been shown to increase the vasodilation. The more the vasodilation, the better blood flow happens, right? If it is blood flow is constricted and all that, it will cause unnecessarily blood pressure. So it releases blood pressure also, right? It solves blood pressure challenges also. In addition to that, macrophages, which are immune cells, they go and engulf the bacteria. They can engulf bacteria and drink it, eat it. That's what they do, the macrophages. They are very helpful cell for our body functions. And of course, in the brain, this neuron is producing nitric oxide, and that nitric oxide acts like a neurotransmitter in the brain. Macrophages, it activates the macrophages so that it can do its job of engulfing bacteria, and in the blood vessels uh, it produces vasodilation. So there are different functions of nitric oxide, which is produced by Bhramari Pranayama. So nitric oxide has been shown to inhibit the replication, which means multiplication of virus, especially this COVID virus. That this particular work came from Sweden, Stockholm, and its role in immunity is par excellent. There is no doubt. We know that macrophage is one of the main things that tackle the bacteria and other things. So the first line of confrontation with any pathogen that comes inside our blood or wherever, nitric oxide is extremely important for that. Now, can the Bhramari Pranayama be useful in the brain and in brain disease prevention? So yeah, probably. Let's see whether any of these hypotheses is true or not. The first hypothesis is Bhramari Pranayama causes neuroregeneration. And second hypothesis is Bhramari Pranayama causes neural differentiation. Now, for regeneration and differentiation, it has to migrate. Otherwise, it has to be created inside. It has to be, some of the stem cells needs to be activated. So, if that stem cells is getting activated by Bhramari, obviously, it will become those stem cells will become differentiated into new neurons, and it will cause neuroregeneration. So that's what it is. So let's find out the data. The data says the nitric oxide can be potential tool for nerve regeneration. Now I have a feeling that probably in the spinal injury, post accident and things like that, nitric oxide can be of great help. However, course, you cannot hum your way into the spinal cord injury, but for brain injury or brain degeneration, neurodegeneration, it can be useful. Now, how it is useful? Nitric oxide signaling provides a switching mechanism between degenerative and a regenerative state. So what happens? Let's say a neuron is in a degenerative mode right now. Why it is degenerative mode? It is sitting quietly, nobody is there to say hello, and nobody. So in neuroscience there is a saying that neurons that fire together wire together, or neurons that wire together fire together, so that association of other neurons keep each other neuron healthy. So if one neuron is not giving the signal to the other one, both of them die. So that is why the exponential decline in the cognitive functions and other things, the neurodegeneration is exponential in nature basically. So why? Because two neurons are dying every time, not one. So nitric oxide after Bhramari can make that so-called degenerative neuron, who was almost on the verge of putting itself into into the grave, is now suddenly reactivated, and it can be regenerated back again. Though that is the power of nitric oxide. And nitric oxide from where? From Bhramari Pranayama, right? Now, second thing is sound waves promote neural differentiation. That sound waves have been shown in the world to produce neural differentiation, and of course, we are creating the same. Not only one particular frequency, we are producing a variety of frequency, the entire spectrum of frequencies, sa re ga ma pa dha ni, right? All the seven swara have been used by us to promote differentiation of different cell neuronal types, right, in the brain. So that's what it is. Possible Bhramari applications are as follows: prevention of neurodegenerative disorders such as Alzheimer's disease related dementia, amyotrophic lateral sclerosis. In amyotrophic lateral sclerosis, what happens is the neurons in the motor cortex, which is the GABAergic neuron. Remember the first slide I showed you, the GABAergic neurons in the motor cortex are not happy there, or they are almost in the verge of degeneration. So if you do Bhramari Pranayam, those GABAergic neurons will be activated again, and they will make connection back into the spinal cord and go all the way to the nerve, to the muscles. So amyotrophic lateral sclerosis can be prevented, I think, through this. Or if somebody is already doing this, it will have none of this will ever occur to him even. Parkinson disease, where dopaminergic neurons are dying, you can create the same stuff because of the different intonation frequency. Dopaminergic neurons are there, GABAergic neurons are there, serotonergic neurons are there. So many different kinds of neurotransmitter producing neurons are there, and each probably might have a different frequency of resonance or vibration, right? So, or this is how it is. And then the prevention of brain fog and confusion, fragile mind. This particular challenge was seen during COVID time, or those people who have had COVID but now they are okay, but sometimes they get this brain fog. They are COVID free now, but they still continue to experience brain fog, confusion, fragile mind, and this is called long COVID. I am sure most people still have that problem right now. And of course, prevention of depression. You know that first slide we showed you. Yoga and pranayam can solve the problem of depression and anxiety. Boosting immunity, you know that very well, and preventing blood clot related stroke. If the small blood clot is roaming around in the bloodstream, let's say, when it comes to capillaries, which is very narrow blood vessels, maybe it will not go through that. So, but Bhramari can allow a little space, vasodilation can happen, and some of the blood can flow properly. If the blood flows properly, what happens is you will not have stroke. Suppose the heart capillaries are not doing well, it will make the heart function very well back again. Prevents high blood pressure, absolutely. So this has been shown over and over again. People who have sphygmomanometer at home, blood pressure monitor, they can check that. This is a fact of life. So you can, most of these things you will, because this is Alzheimer disease, is basically, this is the inside deal here. But if you do this, probably you will not have any symptoms of it. So that's where I end my presentation. Thank you all very much for being associated with me, and you already have subscribed. So many of them have subscribed, and I am really grateful to them. Please like, subscribe and share this video if you found it useful. Thank you very much.